I was diagnosed with uterus cancer this year, 2017.
About 5 years ago, I had my routine mammogram. I did go in and found out that I had breast cancer.
I was going through a separation with my spouse, and my little one was about 8 months old. I just felt like I couldn't do anything. I felt alone.
I did what the typical nurse does, which is imagine the worst case scenario. And as a result, I had myself way down that road of bad news, bad news, bad news.
I never really knew what postpartum depression was. I had a lot of supportive people in my corner, but they didn't really know a lot of what was going on. So I had tried to take my own life.
Dr. McCloskey was calling me. She said, "Charlene, I'm sorry to give you the bad news. It is cancerous." So she was telling me, go ahead, it's okay to cry. But what I want to tell you is that it's going to be okay. I got a doctor in mind. Within 45 minutes, my phone rang. That's the first time I heard of Dr. John Hoff and the SSM team.
I ended up seeing something before I had Aria about the postpartum peer counseling and how to become a volunteer. And I actually called the line, and that's when I had reached out to Kim.
It was a great relief to me to go to my first appointment, which was with Dr. Stephanie Schnepp. Very down to earth, just, I've got all the time in the world to answer your questions, Sarah.
The day of the surgery came, Dr. Hoff, he said, "Charlene," he said, "I sent my whole team to have lunch first." He said, "Because when we come back, we're going to give 200% focus on you." I knew then, if he cared about his team like that, he's sure curious about me.
Such a caring group of women that I came in contact with, and that made me feel stronger being around them.
I wanted to do something where I could give back. If I made it just a little bit easier for them, that rocks my world. It makes me very happy that I could do something positive.
I figured if I felt like that, somebody else felt like that. So I ended up reaching out to Kim after I kind of got myself together to do the counseling to help another woman.
All the years that I have taken care of so many females with health problems, and now the shoe is on the other foot. But it's a total different ball game when it's you in that hot seat.
Having been through breast cancer myself as a survivor, I sometimes share that with my patients. People will say to me, "I'm so glad you told me that. It really made me feel better and that you understood what I was going through."
And I remember this one patient who dealt with the same uterus cancer I did. She said, "You know, I really enjoy talking to you. You made me feel like I'm not afraid to go on the other side anymore." I just held her in my arms, and she passed.
I wanted to make sure that I learned how to get through my issues and stuff so I can help somebody else.
And now, I think the thing that's so wild is I work with these people daily. I'm with these people that help me all along the way. It's incredible. I love it. I do, I love it. I'm Sarah Myers, and I have worked at St. Mary's Hospital for 28 years as a nurse.
I'm Jasmine Kimbrough Brown. So I am a volunteer as a postpartum peer counselor.
My name is Charlene Hodge. I'm a wife, a mother, and a grandmother. I'm also a nurse assistant with SSM Hospital.